This podcast has been developed and funded by Accord in collaboration with people living with prostate cancer, their loved ones, and healthcare professionals. Please note, episodes are not designed to offer medical advice, and people appearing on this podcast are talking from personal experience. Hello, welcome to the Unmentionables, a podcast that brings you unfiltered conversation about prostate cancer. This series has been created with and for people affected by prostate cancer and their loved ones. It aims to bring you open and honest discussion around some of the key challenges associated with the condition. I'm Jeff Stelling. In this episode, deciding on a treatment option can be an overwhelming task and can be one of the biggest challenges for someone newly diagnosed with prostate cancer. There are multiple treatment options for prostate cancer, some specific to different diagnoses, and each with their own benefits and risks to consider. There are multiple factors that will impact a person's decision when choosing a treatment option that is right for them. Today, we're going to hear from a few individuals that have been through this decision-making process. This episode isn't telling anybody what they should do. It's about sharing experiences and empowering others with the right information to help them make their decision. With me today, I'm joined by Sanjiv and Allan, two men who've been previously diagnosed with prostate cancer and who are here to share their experiences of this treatment decision process. And joining us too is Bill, who is a urology consultant who will be sharing his perspectives on this topic as a healthcare professional. So Sanjiv and Allan, choosing a treatment option. Now, I think you both had very different approaches to this. Sanjiv, tell us about your approach. What affected your decision?
I guess the first thing was receiving the diagnosis is a bit of a shock to the system. And then understanding what that actually means beyond your own mortality and your immediate family concerns. With the diagnosis I had, I was aware that I had two primary tumors within the prostate, and one of which was coming towards the end of the capsule. So there was a concern that it might break out and therefore spread through the body. That was very worrying for me, and I felt time pressured to make a decision quickly. We were just coming out of lockdown at the time. Services were not fully up and running yet. And at the time, the two primary options I was given was, one was a radical prostatectomy, and the other one was to have radiotherapy with hormone treatment. I was aware that if I had the radiotherapy with the hormone treatment, and should all the cancer not be removed, then doing a prostatectomy can become somewhat more difficult. It can change some of the structures around the prostate. But I was also aware that there were a couple of other treatments going on, brachytherapy and HIFU. And these weren't available to me at the time because of the restricted services. But I was interested in doing what was right for me. And if there were two tumors and we could remove them without affecting all the prostate, which could impact your sexual function, your incontinence, those were important considerations. And I was pretty much in my head thinking, well, I've got two tumors, we can have these whipped out. And then the scan results came back and my prostate lit up like a Christmas tree. And there were cancerous cells everywhere. So all the time I'd invested in looking at different treatment options basically were negated. And I ended up having to consider having a radical prostatectomy because that was the only way to remove it. And so that's how I went about making that decision.
How long did that decision-making process take for you? I know it was an irrelevance in the end, but...
It was probably 6 weeks in the making, because even after the diagnosis, had I even selected to go for a radical prostatectomy immediately, it was still a 6-week wait. And so I had that time to look around and work out what I could do.
Yeah. And Sanjay, who did you speak to? Was it just clinicians, family, friends? Or was this your decision?
No, I think prostate cancer obviously affects my family, my wife, and the decisions were very much made in concert with speaking with her. But even though I have a medical background, I wanted to explore conversations with other men who had had their own journeys around the treatments that I was considering. And that was invaluable because each one, they gave up their time. They spoke to me very honestly about the good and the bad and some of the regrets that they had. And that really helped give me a lot more information around what I needed to consider when deciding which treatment option I'd have. That was even more impactful because the decisions were not guided through the medical staff that I was engaging with. They were very lovely people. They gave me a lot of information, but there was no real guidance. It was almost like being given an a la carte menu and saying, okay, take the pick you want. And then when you've got all this confounding stuff going on in your head, that speaking to other people is very beneficial.
So, Allan, how was it for you? What was your decision-making process like?
Slightly different to Sanjiv's, as we've discussed before. My diagnosis was given to me by a clinical nurse specialist, and I was a bit surprised at that because I thought a man who's just been given the notice that he's got cancer should be given to him by a doctor or a consultant at least. During that consultation with the nurse, I couldn't get any of my questions answered thoroughly. So I asked if I could please have a consultation with a urologist. And this was arranged. But in the meantime, they gave me a pack of information to take home and have a look at, which I went through, and I kind of dismissed some of the treatments in the hope I wouldn't need them, and kind of leant towards another one. So when I had the consultation with the urologist, who was very good, we went through all of the options that were available. He said, you don't want this one or that one because it's a little bit like a sledgehammer to crack a walnut. So let's look at this. And he wanted me to go on active surveillance, which means that every 6 months, 9 months, however, the longer period that he chooses, you get your PSA checked again to see if there's any movement. And like Sanjiv, I also had two tumours that were possibly likely to branch out and grow faster. And my words to him were, well, it's my body. I can't see these tumours. I have no idea what they're doing. I'd like to get rid of them. And I said, I've been looking at this option of brachytherapy. And as soon as I said that, he started writing a letter on the computer to the hospital that were the specialists in brachytherapy. So about 2 weeks later, actually just after Christmas, I had the appointment in Guildford, and I spoke with the clinical nurse who took me through the various examinations and routine wee tests and examinations, and then I went in to see the guy who was the head of the brachytherapy department, and he said to me, first of all, he said, "Can I apologise for you being in the situation you're in?" And I said, "Well, thank you very much, but it's not your fault." He said, "But we can emphatically deal with this." And that was my decision made. I said, "Let's do it." And it was that simple in the end.
Yeah. I mean, it sounds very simple, but the first thing I think is that you guys, you've just been told that you've got prostate cancer. You're having to deal with that and then make a key decision while you're still recovering from the shock of being told, that you've got prostate cancer. That must be incredibly tough.
Well, 20, 30 years ago, you would be told the treatment you were getting, but now the onus is on the patient to decide what they want, which is why it's important that the patient gets all the information available to them and all the treatments available.
Sorry, Sanjiv.
I was just going to say, I'm sure it's the same with any other cancer or disorder, but this affects your potency as a male. And, you are accustomed to behaving in a certain way in sexual relationship with your partner, your wife, whoever it should be. And making a decision that can have a detrimental effect, at best, an interim detrimental effect, you absolutely need to have that other person's understanding and buying into what you're doing, because it's a relationship that's going to get affected. And that can be equally daunting as everything else going on. So that, for me, was a new challenge, to have to be very transparent and very open about what this could mean. Yes, I wanted the surgery and I wanted it to be nerve sparing, but you don't know what happens until they get in there. And as was the case with me, they found that there was a creep of cancer along the urethra going towards the bladder. Fortunately, caught it in time. But had any of the cancer been around any of the nerves, then they may not have been able to have done nerve sparing. So yeah, it becomes more and more complex as you go through it.
Yeah, we had similar discussions, but I mean the first point that's the most relevant is survival. So whatever it is you need to do to survive, you have to do. What comes along with it is kind of secondary. But we had the same conversation that Sanjiv's talking about.
So in your head, you've got a list of you're prioritising
Yeah,
the important things in life to you.
Yeah.
Life being the
Yeah,
most
absolutely.
important.
Yeah, no,
of course.
absolutely.
I mean, Bill, it's interesting. Sanjiv mentioned this a la carte list, if you like. So, I mean, just run us through what sort of options are available.
Yeah, firstly, I'd like to thank Sanjiv and Allan for sharing their journey. I think you've highlighted two factors which I feel are really important. Is that obviously when you hear the word cancer, it's very emotive, isn't it? And then often clinical teams just continue the conversation once they've told you you've got cancer. And I suspect that you had a brain fog at that point and didn't hear an awful lot after that. So I think it's really important that clinical teams appreciate that actually they need to separate the delivery of the diagnosis, telling a man that they've got prostate cancer, and then the conversation about the options which are available to them. They need to create space so that the man can actually absorb that, that life-changing diagnosis and separate the decision-making about treatment, which often is rushed. We know that a national survey has shown that up to 20% of men have treatment regret. And the two main reasons for that is that they felt rushed and the options, and particularly the side effects of the different treatment options, were not thoroughly explained to them. So I think we need to tell a man that they've got prostate cancer. You then worry about survival. You mentioned this, Allan, that survival is the priority at that point in time.
Absolutely.
Then give them space, and then start to introduce the treatment options.
Well, I go along with that because I actually indirectly got the space you're talking about.
Yes.
Because I was given a diagnosis by a clinical nurse specialist who couldn't answer all my questions. Right. So I asked for a further appointment with a consultant. And that actual gap gave me some time to go home and talk to my wife and have a look at things. I never once went on the internet, by the way. I read the brochures they gave me and I talked to the specialist, but I never went on the internet.
Do you feel, though, that men do feel pressured to make a decision quickly?
I think it's really warming to hear Bill address the point about giving space. Doing the patient support stuff that I do for some different charities, we've come to that realization that men, having been given a diagnosis, are exactly that. They're in this kind of fog mentally. And talking to them about treatment options too soon is just confounding the issue. So that's really great that you're doing that. And I hope that continues to be the case with more clinicians. The survival thing is, yeah, absolutely. You've got cancer. You don't want to die from it. So I get that. But in my case, when I was having discussions about the radical prostatectomy, I was very concerned about having a nerve-sparing procedure, which allows, after the trauma of the surgery, to hopefully regain your control of erections and so on. And I spoke to a couple of different physicians, and one of them was just dismissed it and said, you have cancer. My primary job is to get rid of the cancer. And that's what I'm focusing on. For me, I wanted to speak to someone who had the capability to address that. Yes, I've got to remove the cancer, but if I can do nerve sparing, I will. Now, obviously, you don't know until you're there, but at least have that as a can-do attitude. And so for me, that really became, the two of them were intertwined.
Yes.
Yes, I want the cancer removed, but yes, I want nerve sparing.
Absolutely. Allan, you raised a very important point, actually. It's a very good analogy of the menu. And we often, as clinical teams, give patients a long list of treatment options. and then ask you to make the choice. But so I think the menu analogy is a very good one. If you go to a restaurant, a very good restaurant, often somebody will guide you to which meal to choose. And often there isn't one perfect meal choice. And I think that's very important for clinical teams to emphasize. If there was one perfect treatment, it'd be a very short conversation, and every man would opt for that treatment. But there isn't one single treatment which suits everybody. So the importance is guiding the patient to make the best decision they can possibly make. And to do that does need space. It needs the right information. And so for some men, that might mean going and using some of the internet resources, there's some fantastic resources available, but gathering the information and answering the questions that you may have. And as you say, Sanjiv, it's not just the cure rate of the individual treatments, it's the potential implications it has on your lifestyle, your job, your family life. But if you should experience any of the side effects, how are they going to be managed?
Yes.
Well, just developing on that point, Sanjiv mentioned earlier that he spoke with a number of men who'd experienced different treatments for prostate cancer. There is a network that you can use where it's called a buddying system, and I'm assuming that's who he spoke with, or people that maybe he knew. When I was diagnosed, I didn't know that kind of thing existed. I didn't know that there were support groups. And I now belong to a support group, and the value of men talking to men who have experienced what they might be going through is invaluable.
It is.
And it helps them make the decision in the end as well. We've had men come to our group with the idea of this particular treatment, and yet left the meeting in the evening having heard different comments from different men about their treatment, and gone away with a different idea altogether. And to speak to their consultant about it. So the more information you've got, and the more you talk to people who've gone through it, the better the decision can be for you.
I mean, Bill, what would you advise in terms of somebody who's had a prostate cancer diagnosis and has told, as Sanjiv was, by his clinician, my job is just to save you? What advice would you give them?
Well, I would advise that you almost challenge in a constructive way your clinical team.
It's quite difficult, though, isn't it?
It is, yeah, absolutely. The dynamics are difficult, aren't they? Especially in that emotional time. But it is to challenge your team to go beyond survival rates, go beyond the practicalities of the treatment in terms of when it will be delivered, how it will be delivered, but to discuss more about what is the chance of side effects? And if I was to experience those side effects, what impact is it likely to have on me as an individual? Look beyond the statistic.
Yeah.
And if I was to experience that side effect, what is available locally to help me manage it? And those are the conversations which are so crucial. And perhaps the conversations you don't think about having right at the outset. And this comes back to having that space, the time. Unfortunately, within the NHS at the moment, we are very much a time target driven service. We are, there is an ask of us as clinical teams to deliver radical treatment within a set time period. And that gives men a very little opportunity to take a step back and think about the various treatments and the implications of those treatments.
I think there are a couple of things that pick up there on Bill. One is constructively going back and speaking with the clinical team.
Yes.
Absolutely. But, clinicians, doctors, they are human beings just like everyone else. And we all deal with situations differently, regardless of our professional standing. So I think, yes, absolutely, we should do that. The second thing is, whenever you go to any of these consultations, I always advise, take someone with you, whether it's your partner, your wife, or a buddy, or whoever it is. Because when you're there, you're engaging that conversation, you lose thought processing. And it's invaluable when they're there. I know my wife and I would have these conversations before we'd go. And if I'd admitted to ask a question, she was there to help prompt and help listen. Because when you walk away from there, you're then exchanging what you've heard. Surprising when you're emotionally compromised like that, how sometimes you don't hear the words that are being said.
Yes.
Or you've misunderstood them. So I think it's very valuable.
It is.
And yeah, I went for my consultation of brachytherapy. on the basis that I was going to be talking to someone about what it involved. I didn't take anyone with me because my wife was doing something else, and I made the decision then and there because I thought it was the right one. But
Yeah, I think.
I suppose there's no one size fits all, is there?
No.
absolutely,
Absolutely not. And people, there's opportunities to speak to the clinical nurse specialist within teams. There's charity groups you can contact. There's web pages. There's a lot of resources available to support men and their families make a decision. And it's important that patients are signposted to those.
Yeah.
There's some fantastic, and you talked about the patient experience, how valuable that is. You know, the Infopool website contains a lot of patient stories.
And they're very good. And I think, like Allan, I wasn't aware that there were patient support groups for prostate cancer. Unlike Allan, I did go onto Google and have a look around things, which is how I found these support groups, and through them, how I engaged with these other guys. And, you know, that lived experience of their journey in a short period of time gives you so much more information than you'll glean through reading through reams and reams of stuff and then processing it, and each of us interprets stuff differently. So very valuable.
I mean, obviously the decision on treatment is one of the most significant decisions you'll ever make in your life. And you guys have been there. If you had one key question for people out there who are watching this podcast, one key question to ask your clinician, you know, over treatment, what would it be?
The question that I asked was, if you were in my shoes, what would you do? Why would you do it? In keeping in mind what I want out of that treatment. So in my case, out of my treatment, I wanted the cancer to be removed, and I wanted to have as best a chance of sexual functionality.
Allan, a key question to ask your doctor in treatment
well,
discussions?
Taking Sanjiv's point there about the clinician, I actually went against what he was suggesting because when I asked him the question, I said, if I get the impression that if you were sat where I am, you'd be going for active surveillance. And he said, yeah. And that's when I mentioned about it's in me, I can't see it, I don't want it there, I'd like to get rid of it. So my question would be that what does he consider to be the best treatment to give me the best prospect in life?
And from your point of view, Bill, I mean, same question really from a different perspective though. What would you advise people to ask?
Can I have two answers?
Yeah.
The first one is I would say when you've almost finalized your treatment choice, I would specifically focus on the side effects. If you was to experience the side effects, what is available locally to manage those side effects? So I would be looking beyond the immediate treatment. What can be done for you if you should, which unfortunately are common. Erectile dysfunction, urinary incontinence, bowel issues. How could they be addressed locally? And is there anything you could do now, pre-treatment, to try and reduce those risks? So that'd be one thing. And the second thing would be picking up on what you've said is that don't feel rushed. If you're finding it difficult and challenging to make that treatment choice, and you value a second opinion, ask your clinical team who you can seek that opinion from.
Yes.
And I think that's really important, in that perhaps it'll give you a different and a fresh perspective. It also gives you time. And I would those would be my 2 points.
I personally did the second thing that you just mentioned there. I didn't say that because you asked me to give one answer. But yes, I think that was invaluable.
Yeah, absolutely. It's a big decision. You want as many opinions as you get, don't you? Absolutely. Bill, look, thank you for your expertise. Allan, Sanjiv, thank you for your stories as well. Been incredibly inspirational, I think, and informative to people who are watching here today. So thank you very much indeed.
Thank you.
Thank you.
Now, if you want more information about any of the topics we've covered in this episode, you can go to the NHS website, Prostate Cancer UK, Tackle Prostate Cancer, or Infopool. Accord has been working with a group of patients, caregivers and healthcare professionals to develop a prostate cancer discussion guide. If you want to talk about any of the topics covered in this episode with your healthcare team, The personalised guide can help you think about the questions that you want to ask. You can then download or print those questions and take these to your appointments to have a more informed conversation. You can find the details in the description of the podcast, wherever you're listening or watching. Join us next time if you can as we explore how to look after yourself during treatment. We'll be talking about the side effects, including those which are under-discussed, and hearing some of the first-hand practical tips on some lifestyle changes that can help you reduce the impact of those side effects.